morning, everyone, and welcome to our Health Career Connection Journey to Leadership Speaker Series. I'm Jeff Oxendine. I'm HCC's founder and CEO, and it's my privilege to welcome you to this series and to introduce our speaker for today, one of our inspiring and impactful HCC alums on the celebration of our 30th anniversary. It's my pleasure to introduce Dr. Billy Caceres. Dr. Caceres is an assistant professor at the School of Nursing and the Program for the Study of LGBT Health at Columbia University. He completed his PhD at NYU, and he is currently the principal investigator of several studies to understand the influence of adverse life experiences on cardiovascular disease risk in vulnerable women. He's got much more that he can tell us about. Very importantly, he was a Health Career Connection intern back in 2007 with the Robert Wood Johnson Foundation. I'm sorry, 2008 with Robert Wood Johnson Foundation. So with that, I'm going to turn it over to Cesar Robles Martinez, who is in our HCC leadership team and an HCC alum as well, who's going to have a conversation with Dr. Caceres. So welcome to both of you, and thank you so much.
Thank you.
Hi, thank you very much, Jeff. I appreciate the introduction. And Billy, thank you again for joining us today. I do have a few questions that we we can run through and kind of get to know a little bit more about you and kind of your journey during HCC and even the years since 2008 when you did your internship with us. And so before that, we kind of wanted to know, so when and where did you do your internship with HCC?
So I was an HCC intern in 2008 at the Robert Wood Johnson Foundation, which is located in Princeton, New Jersey. And as an intern at the foundation, I assisted on several initiatives related to building a diverse healthcare workforce. So I worked with my primary mentor for the internship was Dr. Susan Hassmiller, who is now the senior advisor for nursing for the Robert Wood Johnson Foundation. But at the time, she was the head of what they called the human capital portfolio. And she is, for people that are in nursing, she's a very well-known and respected leader around health policy and nursing issues in general. So I feel like I got very lucky as an HCC intern to be paired with such an extraordinary and really highly influential mentor.
That's awesome. Yeah, and do you think that your experience with this organization, did it have influenced you personally in terms of like your education and your career direction and kind of what has led you to today? And in what ways?
So, I mean, I think the answer to that is yes, it's had a big impact on me. And I think partially because of that nice match that I had through my HCC internship, specifically working with a PhD prepared nurse like Dr. Hassmiller. So as a PhD prepared nurse scientist myself, now focused on health equity research for stigmatized adults, I think HCC really had a big influence in sort of my career trajectory after my internship. I came to HCC after having completed a bachelor's in political science from New York University. And it was right before I started an accelerated nursing program also at New York University. So I think one of the biggest things for me throughout my career, and I think has been that I never really planned out things that much early on. Things sort of just happened, and they happened in a way that I think I was very lucky that they happened in that way. So I think particularly as a first generation college student, I think I always struggled with sort of thinking about what was the next step. So I'm going to get this degree, but what am I going to do after that? And I didn't really have good role models, even as an undergraduate student, definitely people within my family, even to this day, don't fully understand what it is that I do as a PhD prepared researcher. But I think the interesting thing was that the internship at Robert Wood Johnson really gave me a different perspective about the opportunities that would be available to me as a nurse, right? I went into nursing thinking that I would work clinically as a nurse in a hospital and take care of patients, but I had never seen sort of a nurse with a PhD working at a foundation, working in policy, developing programs to improve diversity within the healthcare workforce. And it really, I think, opened my eyes to the other possibilities that I would have as a nurse. And I think particularly the important role that policy plays in healthcare was one of the big things that sort of stayed with me from that internship. And, all of my work is on health equity. So the need to ensure that the health workforce is diverse and that it represents, or that actually mirrors the people that we're actually caring for, has always been one of like the things from that particular program that I worked on at Robert Wood Johnson, which was about workforce diversity, that sort of stuck with me all these years. And really the main thing, on top of having the network and the support of people within HCC, was also, again, Susan Hassmiller was a PhD, or is a PhD prepared nurse, who saw something in me from the 8 weeks that I worked with her and really sort of encouraged me to continue my education and pursue a PhD. And I think that a combination of those things, sort of like the right mentor, the right internship, really sort of put me on a path where I felt much better prepared before I even went to nursing school and really started working in healthcare.
Right, that's beautifully said. And so I guess a question I have on that is, kind of before you came on this journey, what was, if you can remember, that kind of click that kind of made you switch from, I believe you said, political science to nursing? Like, kind of what was it that got you into nursing? Because they're very different fields.
Yeah, but like at the time I thought that they were very different fields, but so much of what I do now sort of integrates both. So I have a degree in political science, which is really political theory. And I sort of was tired of reading about political theory, about like all these political theorists from the 17th and 18th century and 19th century. And I sort of wanted something real and tangible. So I really became interested in nursing after having worked I worked as a sexual violence and an alcohol and other drug use peer educator at the Student Health Center at NYU. And I sort of fell in love with health education, and I loved learning about sort of the physiology and biology behind addiction and some of the things that we were talking about in these workshops that I led. So that, I think I had considered actually switching to nursing my sophomore year and decided not to. But the further I go in my career as a nurse, and so much of what I do is around health disparities, and the biggest driver of health disparities is policy. So a lot of what I learned in my political science degree has now become integrated with all the health disparities research that I do. And I think it gives me a unique perspective to think about so much. I think we talk a lot about what happens during healthcare encounters, but so much like healthcare encounters between patients and providers, but so much of what actually influences health are things that happen outside of the clinic, right, or the hospital, right? And I think that that's really, in many ways, given me a unique sort of understanding of policy as it relates to health. And obviously I've done other fellowships and internships and a number of other opportunities that expanded on that. But I don't think that they're really that different. I think that I say this all the time, that I think healthcare is political and nursing because of that is political. And I think if you have an opinion about whether or not people should have access to certain healthcare resources, then you have a political opinion, because it's all decided based on public policies, right? So I don't think it's as divorced as I probably would have thought in 2008 when I decided to go to nursing school. I think right. I had a different impression of it than I do now.
Right. Perfect. That's the same with me, because in undergrad I got my bachelor's in psychology, and I just finished my master's in public health, like Jeff mentioned, and I'm still even right now trying to see how I can merge both of those fields when I eventually do pursue nursing as well. So like you said, nursing kind of, the beautiful thing about nursing is that you can kind of take it in so many different ways, right? You can approach it through policy, through direct patient care, through healthcare management. Like in some class that I've taken in public health, we've had so many different nurses in my classes as well, and kind of it's beautiful to kind of approach the healthcare setting, having people from various different backgrounds. So it's beautiful. And so I guess on that question, I wanted to ask you. I know you kind of mentioned a little bit about your mentors along the way, especially during your HCC internship, and I wanted to ask you, how do you tend to rely on as mentors, or who do you tend to rely on as mentors or other advisors even now? Very kind of, some of the higher levels of academia.
Yeah, well, the thing about it is, in clinical practice, because I worked as a nurse for almost 9 years, I'm considered a clinical expert, but in terms of research years, I'm considered early career. So I'm still like very early in my research career. But I think the interesting thing about mentors throughout my career, and I think that this is true for a lot of people, is that the mentors fall into sort of these two categories. One is the category of people that are assigned to you through a graduate program or an undergraduate program, and they're really advisors and maybe they become mentors. And then there are mentors that I sort of sought after, or just like met at a conference and they became a mentor somehow. So I think that I've been lucky throughout my career. I've had many mentors, and there's no way that I can list all of them in the time that we have today, but I go to them for different things. And I think the mentors serve very different functions. So like one of the mentors, which was actually, she became my mentor, I think, in 2015. And at the time, she was my first sort of Latina mentor or anybody with a Latinx background. It's Dr. Adriana Perez, who's a nurse researcher, cardiovascular scientist at the University of Pennsylvania. And she's really one of the few sort of like other Latinx nurse researchers that does disparities work that sort of I encountered throughout along the way. And she's really somebody that I go to for advice on things that aren't even really related to research. It's more about our experiences being Latinx researchers in nursing where we're underrepresented and sort of like navigating those experiences. Another mentor of mine is Dr. Jackie Taylor, and she's a Black nurse and a cardiovascular scientist at Columbia University. But she became my mentor before she came to Columbia. But I go to Dr. Taylor for not only advice on my research, because she's a cardiovascular researcher, but also handling situations that arise from being one of the few racial and ethnic minority people in the professional circles that I run in, right? So in nursing, I'm one of the few men, which is fine. That's never really bothered me, because in clinical practice, I was also one of the few male nurses. So it's sort of the same themes in academia, but I am, in most rooms that I'm in, I'm one of the few like Black or Latinx or underrepresented people in those rooms. And then a lot of the LGBT research that I do, I'm also one of the few Black or Latinx people doing LGBT research. So I really rely on Dr. Taylor sort of for advice on how to like navigate those types of situations. Then I have other mentors at Columbia who are really research mentors. Like there's a number of them, like Dr. Tonda Hughes, Dr. Walter Bochting, Don Edmondson, and they're all experts on either LGBT health or cardiovascular health. And I go to them really for research expertise. But I think the other thing that's been important about mentors is the things that my mentors have done for me that I didn't even know they were doing. So I've had mentors who have really elevated my standing within professional organizations like the American Heart Association or the Gerontological Society of America, which are two of the organizations that I belong to, by sort of doing things. And it's going to sound bad, but sort of like behind the scenes that I never even knew it was because of them. So even being appointed to a committee, that really, within American Heart Association, is really my PhD mentor, Dr. Deb Chun, has really sort of championed me in putting me into leadership, recommending me for leadership positions in the American Heart Association. So I think recently I led the American Heart Association's first scientific statement on the cardiovascular health of LGBTQ adults. And really that came about because my pre-doctoral mentor, Dr. Chun, recommended or put my name forward as somebody that should be on that writing group. And then I ended up becoming the lead of that writing group. So I think that mentors have so many different functions. And I think that sometimes good mentors are mentoring without you even realize that you're being mentored. And that's one of, I think, the unique things that I've noticed about my mentors that I try to take with the mentees that I have. Sort of like, if I see an opportunity that I think that would be really good for them, I think about, like bringing up their name or recommending them for something. I also think when we talk about mentorship, that the value of peer mentorship can't be overstated. I think being one of the few underrepresented minorities within nursing research and LGBTQ research, I've developed really strong peer mentorship relationships with other junior faculty. And these are people that might not even be necessarily doing similar research as I am, or might not even be nurses or even LGBT researchers, but they really provide sort of like a sounding board to discuss issues that I might be having. And really my peer mentors are the people that I go to sometimes if I'm struggling with how to approach my mentors with something, like having a difficult conversation. I'll sometimes go to my peer mentors. And I think that's been really valuable to have other people at my career stage, which again, I'm early stage in academia, that I can trust and rely on throughout the process. And I think sometimes even with peer mentors, you know that the feedback or the advice that you're getting isn't sort of like being colored by anything other than they just want to see you do well. And I think sometimes that's easier to sort of get harsh criticism from your peers than it is sometimes from more senior people. I think sometimes it's harsher when it comes from somebody more senior.
Yeah. Uh, thank you for sharing, Billy. And I guess a follow-up question on that is, did your passion for research kind of was it introduced to you through your networks, like your peers, or through some of your mentors? Because as a Latino person myself, I never really knew about research until maybe my second, third year into undergrad, and I was like, well, what's research? So kind of like, how did you get involved, or in the research field, and maybe share with us a little bit about your health equity research work that you're doing at the moment?
Well, I mean, I think my first experience with research was really at Robert Wood Johnson Foundation. I mean, I knew I had professors that were PhDs at NYU, but I didn't really understand like what they had to go through to get a
Right.
PhD or what they really did day in and day out, other than like teach courses. I thought that that's sort of what professors did, but I, the great thing about research, and I think the reason why I was attracted to it, is that if you have sort of these lingering questions of like, why are things being done this way? And why aren't we doing it this other way? Or why aren't we thinking about why is it all of a sudden now, and like, it took a COVID pandemic to make people realize that social determinants like discrimination are important. Those were sort of the things that drove me to research, is I wanted to understand why it was that we were seeing worse health outcomes among Black and Latinx people and among LGBTQ people. And that, I think that that sort of was instilled in me within Robert Wood Johnson. But then when I went and worked clinically and started noticing these themes and trends, and really just anecdotal, just the patients that I happened to take care of, that really much of what was driving their health outcomes was really things that were going on in their homes, was like a lack of social support, or they had inadequate health insurance, or whatever it was. And that really sort of like cemented to me that, like, as much as I liked clinical practice, I think one of the things about, and I worked in critical care, like in ICUs towards the end of my nursing career. And like, although I really liked it, I enjoyed working with patients. Like, I don't know if I ever really like woke up that excited to go to clinical practice. Like, it wasn't something that I found myself like excited to do. I liked going and seeing my friends that I worked with and seeing the patients again the next day that I had taken care of. But I think when I started doing research, I was really excited about the questions that I could potentially pose and answer through research. And that was sort of what made me make the leap from like a clinical nurse to becoming a researcher. And a lot of what I do now, because the work that I do is all around cardiovascular health, and it incorporates social determinants, but it also incorporates social determinants like discrimination and how they influence physiological risk factors like hypertension and diabetes. So a lot of my clinical knowledge I incorporate in the research that I do every day. How do we properly measure blood pressure? It's all based on the clinical experience that I had, or whether or not this is an appropriate research question that'll impact clinical practice. Like, all of those things were really informed by the years that I spent as a clinical nurse. So I don't want to diminish the fact that like, that I don't think I was born to be a clinical nurse, but I think that the experience of being a clinical nurse has made me a better researcher, and also just like a better person, just having to deal with different people and seeing the life situations that people encounter and the things that people sort of survive, and the sort of the environments that people thrive in, even when the odds are against them, has sort of been really inspiring to me just as a person.
Right. Thank you. And now also, I guess I wanted to ask you as well. Kind of, I know a lot of the interns right now with HCC, we are kind of still navigating the world in terms of where we want to go next, and kind of what careers to approach. And a lot of this is based or influenced by our culture and kind of where we were brought up. And I wanted to ask, how did you overcome some of the stigmas or gender biases present about being a male nurse? At least for me, with going into nursing, I've always heard like, oh, nursing is a female profession, or and if you look at the numbers, it's, I think right now the workforce is 13% male nurses.
Yeah.
So there's kind of a huge disparity in terms of the gender of the nurses in the workforce now. So if you did experience that, how did you overcome that, and what kind of allowed you to still make it this far in nursing?
I mean, I think the thing is, so being male is one of the few identities of privilege that I have, that I think I have, right? So I think I had those concerns early on. I remember early on, I had a conversation with somebody and I was concerned about being a male in nursing, but truthfully in practice, it never really was a problem. I think like there were issues or maybe like a female patient wanted a female nurse and we just switched around assignments. But for the most part, you have to think of it the other side of the coin was, well, male patients, many of them were more comfortable with a male nurse. Or like if there was a gay man, like they were much more comfortable having like a gay male nurse taking care of them. So I think that representation matters in a number of different ways. But I think for anybody that's sort of worried about sort of like the gender differences in the workforce within nursing, I find that there's some issues that are unique that come up, but in my experience, they really weren't that insurmountable, or I can really maybe name like one or two situations where it became a problem. Um, and 13% is when I started as a nurse, it was 9%. So I think the 4% increase in 10 or 11 years is pretty good. And I think it's only going to keep going up, actually.
Right, right. And I think I'll follow up on that is, what do you think a different perspective that male, especially, or even just different nursing, whether it be male or female students, what type of different perspectives, or what are the benefits of us being able to go into the nursing profession? What different advantages do you think we bring into the field? Why do you think it's important for more people of color to go into these professions?
Well, I mean, I think that that early research that I was helping with at Robert Wood Johnson around health work, the diversity of the health workforce. Like, I remember looking at the numbers and thinking, like, I forget what the numbers exactly were, but it was something like nurses. It was something like at the time, Latinx population was something like 15% of the population, but only 2% of nurses, right? That's a huge difference. And I think it's sort of like you can feel it in the air when I would take care of a patient who was Spanish speaking, for example. The moment that I started speaking to them in Spanish, everything would change, right? Like there was just a different understanding of like people's cultural needs and their values. And there were plenty of times where I would be asked to go and help translate for an English speaking nurse working with a Spanish speaking patient. And there were many times where I was just like, why don't we just switch and you take my other patient and I will take the Spanish speaking patient? Because this patient's going to have probably a bet, and not that you're not a great nurse, but just like, I think in some ways, like they would forgive certain things because they had somebody who looked like them and understood their cultural values in a way. And I think that that can't be underestimated. And that's, I think, why it's important for more Black and Latinx people and people from other underrepresented backgrounds to go into clinical practice or healthcare, because people need to see themselves reflected in their providers.
Right, exactly. And I know I want, I know we have a few minutes left, but I wanted to
Yeah.
ask you, Billy, how do you balance life and career, and just in general, how do you take care of yourself? Like especially right now, and well, everything that's going on with COVID-19, how do you kind of, balance everything that you do and still be able to, take care of your physical and mental health?
Yeah, I mean, I don't think that I do as good of a job of having a work-life balance as other people, but yet like most of the people around me think that I have a better work-life balance than them. So I must be doing something right, but I don't necessarily feel that way sometimes. I think the surprising thing for me has been that during COVID, I have had a better work-life balance. And I feel bad saying that because I have so many colleagues who have small children or older parents that they're taking care of during these times during COVID. But for me, I've been able to take more time off on the weekends to do things that I wanted to do. I think that the important thing to understand with any job is that there are times where you're going to be busier than others, right? So if I know I'm writing a grant, that's going to take a lot of my time and effort, but I still need to, when that grant is submitted, take time off to replenish and re-energize. Because I think the thing that gets lost, and I understand this more now, is that research is a highly creative endeavor and you need to sort of like be relaxed some of the time to come up with like cool ideas and like be able to pursue those ideas. And I think that some of my best ideas have come when I'm like out walking my dog. Instead of like sitting at home writing a paper, I'm actually out doing something and then I get a really good idea. Or in the shower, I'll get a really good idea. But I think one of the great things for me has been I love baking. I think most people in my life know that I love baking, and I've been able to bake a lot more now during the pandemic. I don't necessarily end up eating all of it. But I think the other great thing has been sort of like before, to have dinner with friends, it was sort of like a big to do to get like 10 friends together for dinner, because you had to figure out what days people were available to go out to a restaurant. You had to figure out what restaurant it was. And now doing these, I've been doing these virtual happy hours with my friends every Friday. So I've actually been able to reconnect with my friends in ways that I think would have been harder to do in like a loud restaurant or a bar. So those are the types of things that I've appreciated that have sort of kept me sane during the pandemic. And I think that whatever it is that makes you happy, I think that that's the thing that you, whether it's a pastime or spending time with family, I think that you need to make time for that. Because before the pandemic, I was working like Saturdays and Sundays sometimes because that's just what I had to do. But now I will take the full 2 weekend days off and just like hang out. And I think that that's really important.
Right, right, and I mean, we deserve it, right? One thing that one of my mentors told me is that the work will always be there. It will always be there,
Yeah.
but the more we wear ourselves out, we won't. We can't guarantee the same thing for us. And just for the last few minutes that we have, Billy, I wanted to ask you, do you have any advice to our HCC alums and others who are joining us today, or who will be seeing this recording in the upcoming days? Any type of advice, whether it be career advice, personal advice, or anything else we are venturing into our journeys.
Yeah. I think that one of the things I've learned over the last 12 years since I was an HCC intern is to trust myself. I think that there were many times where I doubted my abilities or or even my intuition. My gut was telling me to do something and I doubted it. And I think that that's something that a lot of people from underrepresented backgrounds, particularly when you start like working or rising up in a career stage, you start doubting yourself, this idea of imposter syndrome. And one of the things that I learned, and really only recently, is that giving into like those feelings of inadequacy, of imposter syndrome, really is like a fruitless endeavor. I think that you just focus on the work and you focus on your strengths and you figure out, well, what are these areas that I have weaknesses in? And you can take a course or find a mentor or collaborate with somebody who has strengths in an area that you're weak in. But I feel that over time, and maybe because things have sort of worked out for me over the last 13 years or so, that like I've learned to just trust the process and trust that like I'm at the right place at the right time. And I think the other thing is I've never regretted the times in my career where I made a bold choice or a bold move, but I did regret the times when I didn't make the bold choice or the bold move, right? Even if I was rejected, or even if I didn't get into whatever school or didn't get into whatever fellowship or internship, I didn't regret applying. I regretted the times that I didn't apply myself, or I didn't apply to certain things. So I think it's really important, right? So if you sort of need to like show up to be in the game. And I think that that's an important thing to remember.
That's beautifully said. That's one thing I can relate as well. It's kind of, if you don't even try, or if you don't, the chances of you getting something that you really want, if you don't even say submit an application or apply to a job, are zero, right? If you submit it, it's even if it's 1%, it's 1%, right?
Yeah.
But other than that, Billy, I know we are at time. And
Yeah.
thank you so much for joining us today. I know this means a lot for people who want to go into nursing, in particular, for people like me, who I'm a Latino male who's interested in going into nursing, and definitely having people like you that we can look up to and kind of see that these types of journeys are possible. It does mean a lot. So thank you so much, Billy, for joining us today. And to everyone who's joining us today, I just want to let you know that we are going to be having our next Journey to Leadership on Tuesday the 19th with Denise Fair, who is the Chief Public Health Officer for the City of Detroit. And you can register at the link that we will share together with this recording.
All right.
Great.
Thank you so
Well,
much.
other than that, thank you very much, Billy. I appreciate it. Thanks everybody for joining us. Have a good day. Bye-bye.